Welcome back to Sister Circle Live. According to the Center for Disease Control and Prevention, 30.3 million people in the U.S. have diabetes. Let me make this number even more real for you. That's nearly 10% of the U.S. population.
Well, Dr. Jen is here today to break these numbers down even further and also fill us in on the signs and prevention. So welcome, please, Dr. Jen.
Welcome
back.
Dr. Jen, you're so pretty.
Okay, you know, when I was growing up, I would always hear my aunts call it the sugar.
The sugar. That's what it's called.
I got sugar.
Yes.
And so diabetes, they called it
The sugar.
the sugar.
That's what it is.
Right.
Tell us what having diabetes means.
Right. So, and I'm glad we're talking about this because a lot of my patients still call it the sugar, and I still have relatives that call it the sugar too. It's called, or we've called it the sugar because it's a problem with our blood sugar. That's what the problem with diabetes is. And the real issue is, especially for type 2 diabetes, there's different types, but we're going to focus on type 2, which is the type that, with the numbers that we just talked about, that many of us have. The problem is that there's too much sugar in our blood and not where it's supposed to be, which is in the cells. And you say, well, how did it get there? The problem is insulin. Our insulin's not working the right way. Plus, we may be eating too many foods that have sugars in them. So that combination allows our body to be overloaded and you get too much sugar in the blood. That's why we call diabetes the sugar.
Now, you just touched on it a little bit, but break down very quickly type 1, type 2, because there is a difference, a huge difference. That one is unavoidable if you're born with it, the other is adaptable.
Thank you, doctor.
Well, I'm just saying, but the people need to know from a doctor's point of view.
But you know, but you're exactly right. So there are different types of diabetes, type 1, type 2, even gestational diabetes. Many women out there who've given birth maybe were diabetic only when they were pregnant, right? There's other types of diabetes. So type 1, you're right, is unavoidable. People are born with it. It's an autoimmune condition where the body does not make insulin. Insulin is a hormone that's made in the pancreas, and that's the hormone that we need to put sugar in its place, so to speak, and to keep it out of the blood and keep it in the right spots. So those people aren't born with it. It's autoimmune. They usually are diagnosed earlier than those with type 2. Type 2 is an issue where, we have an insulin problem, but it's not that our body doesn't make it. Maybe our body doesn't make it as well or use it as well, but the other part is what we're taking in, what we're eating, and not exercising. Does that make sense? So type 2 is more of a lifestyle, genetic, type of thing. Type 1 is genetic, but it's autoimmune. You're born with it.
Who's at risk for type 2, and is it reversible?
Thank you for asking that. That's one of the first things my patients ask me, because a lot of people think of this as, not to be scary, but a lot of people think of this as a death sentence. First of all, diabetes is not a death sentence. You can live a very happy, healthy life with diabetes, but risk factors for type 2 are, let's just talk about the elephant in the room. Being African American, being black, period, off the top. And it's our last one on the list, but I'm talking about it first because it is, just by virtue of being black, it is a risk factor, okay?
Wow.
Right, so we are at risk just because of our skin color. Being overweight, age of over 45, family history, if you have people in your family, not exercising, things like that. But it's a condition that really runs in our communities. It's in our communities. Well, so some of it, so it's not just African Americans, but we saw Alaskan Natives, etc. It's a racial, cultural thing that goes a little bit beyond diet. But yes, diet makes a big difference.
Okay, well, I have two questions for you, and they kind of go in tandem. The first one is, how are you borderline diabetic? Because we always hear that whole that borderline. And how do you? What are the telltale signs that you might be at risk for diabetes?
Okay, so borderline diabetes is you're not fully diabetic. Well, so let me put this another way.
You understand? Because it's hey, how you almost there?
Oh, you're not.
But you're not there yet. But you could be almost sort of.
You got too much of the sugar.
But this is the thing. That's exactly what it is. So diabetes, how you're diagnosed is you go to the doctor, you get blood tests done, and we tell you. Now, I'm going to jump to the severe symptoms. If you've got severe type 2 diabetes, you might have increased thirst, increased urination. There may be other signs, okay? We got those up there. These are very severe signs of diabetes that if you're way, way over the top, you may have these. But you don't have to have these to have diabetes. And so you go to your doctor and you get a lab test. So pre-diabetes, you say, 84 million people have pre-diabetes.
Oh my goodness.
That's 1 in 3. Now what that is your sugars are not at the level to be called diabetic. There is a threshold that once you get over that threshold, but they're higher than normal. And we have strict cutoffs, okay? We want your fasting sugar to be less than 100. And if your fasting sugar is between 100 and 126, that's borderline.
Mine was 84.
Well, that's
I just had my blood done. It
Yeah,
was 84.
and it's very important. I hate to cut you off,
It
but I
is.
have to
No,
ask this
go ahead.
question because we all know that frequent urination is one of the telltale signs.
Of severe.
Okay, but you know, there are some nights where you just go to the bathroom too
Right.
much. It's like I went to the restroom like every hour. Like, what's going on in my life right
Don't
now?
get all freaked out about that, because let's say if you drank a lot before you, like drank a lot of water or something before
Or
you
some
went to bed,
alcohol,
or some alcohol or whatever you might have done, that might have you go into the bathroom. So one night of that, don't get all worried about
two.
that. Or two, don't get all worried about that. But make sure you get your checkups. That's what we want everyone to do, because we should have regular lab work to be checking on this.
I was like, Lord, I got diabetes. I'm going to the bathroom too much.
Not necessarily.
Last question,
Yes.
Dr. Jen.
Yes.
For people who have been diagnosed with diabetes,
Yes.
and you know how African Americans, we're known for not wanting to take medication, especially
medications.
older African Americans.
Yes, and
what
younger
advice would
ones.
you give to them as far
Okay.
as not taking the medication prescribed? What is the risk of doing that?
Okay. I got so much to say, but I'm going to
Okay.
be real quick.
10 seconds.
The risk
Yeah,
of
10 seconds.
diabetes, heart disease, eye problems, kidney problems, limb problems. But let me say this to our people. Look, just because you've been diagnosed with diabetes does not mean you can't get rid of it. So if you lose weight, exercise, eat the right thing, you can actually get rid of your diabetes, okay, and not take medications. And you don't have to be started on insulin. A lot of people worry that if they have to take medications, it's going to be insulin. There are plenty of pills out there, so please don't be afraid.
That's amazing. And just like you can get rid of diabetes, you can get rid of a man with diabetes. So, Dr. Jen, thank you so much for joining us today. To get more info from Dr. Jen about diabetes and liabetes and so much more, please check out her website, drjencaudle.com, CAUDLE, as well as her YouTube channel, Dr. Jen Caudle.